A new Ebola outbreak is confirmed in a remote Congo province, with 65 deaths recorded. Add AP News as your preferred source to see more of our stories on Google. Add AP News on Google. Add AP News as your preferred source to see more of our stories on Google. Share KINSHASA, Congo AP, Africa's top public health body on Friday, confirmed a new Ebola outbreak in Congo's remote Ituri province, with 246 suspected cases and 65 deaths recorded so far. Neighboring Uganda later confirmed one death in an Ebola case it said was imported from Congo. The deaths and suspected cases have been recorded mainly in the Mongwalu and Rwampara health zones, the Africa Centers for Disease Control and Prevention said in a statement. The agency said 65 deaths have been attributed to the outbreak and that 4 of those have so far been confirmed in a laboratory. Ebola is highly contagious and can be contracted through bodily fluids such as vomit, blood, or semen. The disease it causes is rare, but severe and often fatal. Scientists were trying to determine exactly what virus was driving the current outbreak in Congo. The Ebola virus, also known as the Ebola Zaire strain, has been prominent in Congo's past outbreaks. Results so far suggest some variant other than the Ebola Zaire strain, with sequencing continuing to give more clarity, the Africa CDC said. The World Health Organization says the Ebola disease is caused by a group of viruses, and that 3 of them are known to cause large outbreaks: Ebola virus, Sudan virus, and Bundibugyo virus. Uganda on Friday reported one Ebola case involving a Congolese man admitted to a hospital in Kampala 3 days before he died. Officials said the case was imported from Congo, and that Uganda has not yet confirmed any local cases. Read more. Uganda's health ministry said the patient was tested posthumously on Friday after neighboring Congo confirmed its Ebola outbreak. All contacts linked to the man have been quarantined, the agency said. The deceased's body has been taken back to Congo. The ministry said the person was infected with the Bundibugyo virus, a variant of the illness that has been endemic in Uganda. The WHO said last year that Congo has a stockpile of treatments and some 2,000 doses of the Ebola vaccine. The vaccine is effective against the Ebola Zaire strain, considered the most severe one, but not against the Sudan virus or Bundibugyo virus, according to health authorities. Dr. Tedros Adhanom Ghebreyesus, World Health Organization Director General, told reporters Friday that the WHO last week sent a team to help Congo investigate the outbreak and collect samples. While initial results did not confirm Ebola, a new analysis on Thursday did, he said. Congo has a strong track record in Ebola response and control, Tedros said, adding that the WHO is releasing $500,000 to aid Congo's response. Affected areas are close to Uganda. South Sudan borders. The latest outbreak comes around 5 months after Congo's last Ebola outbreak was declared over after 43 deaths. Ituri is in a remote eastern part of Congo characterized by poor road networks, more than 1,000 kilometers (620 miles) from the nation's capital of Kinshasa. Africa CDC said it is concerned about the risk of further spread due to intense population movement, mining-related mobility in Mongwalu, insecurity in affected areas, gaps in contact listing and control challenges. The proximity of affected areas to Uganda and South Sudan also raises concerns, it said. The agency said it was convening an urgent coordination meeting Friday with health authorities from Congo, Uganda, and South Sudan, together with key partners including UN agencies and other countries. The acting head of the U.S. Centers for Disease Control and Prevention, Jay Bhattacharya, said Friday that U.S. health officials are in contact with officials in Congo and Uganda and are going to provide whatever they need, and that we are capable of providing them. Congo has seen more than a dozen Ebola outbreaks. This is the 17th outbreak in Congo since the disease first emerged in the country in 1976. An Ebola outbreak from 2018 to 2020 in eastern Congo killed more than 1,000 people. The WHO said that outbreak was characterized by the main Ebola Zaire strain. An earlier outbreak that swept across West Africa from 2014 to 2016 also killed more than 11,000 people. The new outbreak creates more worry for the Central African country, which has been battling various armed groups in the east. The second largest African country in land mass, Congo, also faces logistical challenges. During last year's outbreak, which lasted 3 months, the WHO initially faced significant challenges in delivering vaccines due to limited access. Dr. Gabriel Nsakarler, a professor of public health who has been involved in past Ebola outbreak responses in Congo, said the country and health workers on the ground have a high level of experience in addition to existing infrastructure such as laboratories. In terms of training, people already know what they can do. Now, the expertise and equipment need to be delivered quickly, and Sakarler added. Associated Press writers Chindu Asargu in Abuja, Nigeria, Sale Mwana Malongo in Bonn, Germany, Mark Banchero in Dakar, Senegal, Mike Staub in New York City, and Eveline Usambai in Nairobi, Kenya contributed. For more on Africa and development, https://news.com/hub/Africa Pulse. The Associated Press receives financial support for global health and development coverage in Africa from the Gates Foundation. The AP is solely responsible for all content. Find the AP's standards for working with philanthropies, a list of supporters and funded coverage areas at ap.org.